And welcome in to, this is not Be Our Guest, this is special. This is To Your Health. And we've got something exciting. We have an exciting doctor who is going into practice, Dr. Thomas Lindsey. You're going into practice with Alabama Family Practice. Wonderful Dr. Mark Lindsey, Dr. Kathy Lindsey, and just incredible. They are my doctors, full disclosure, for years and years, and I love them. And one of the things I love about what you do is you are not a big pusher of drugs. You know, y'all try to really heal. And I would like for you, I know that you have a specialty. I'd like for you to just tell us quickly what that is, and then we're going to move into something new for treating pain, and we've all got it. So tell me real quickly, your specialty.
Yeah, so thanks for having me. So I did a family medicine residency, and that's a 3-year thing, and then I also did a sports medicine fellowship after that. I'm also certified in osteopathic manipulation, so I've got some specialty training in both those fields. So my specialty, I really enjoy doing sports medicine. So I take care of athletes and also just the general population's, musculoskeletal pain and conditions.
And you had the pleasure of working with the University of Alabama, I understand.
Yes, Roll Tide, yeah. So that's where I did my fellowship for 1 year. It was a really cool experience. Got to work with all the athletes at the university there.
Well, it takes a very special person to have that opportunity, so that's like a summa cum laude to get to do that. So I respect that very much. You have opened up at your practice something new, a therapy that I would love to know more about, and I would like for our people to know about.
Sure, yeah. So it's called stem wave. The device is called stem wave. It's a form of extracorporeal shock wave therapy, and we're really excited to bring it to the community. It's a way to decrease inflammation. It can increase range of motion, increase strength. Those are the main things that it does. The way that it does that is it actually, we have an electrohydraulic shockwave therapy. So that's the best form of shockwave therapy, in that it reproduces the waveform that creates that effect of anti-inflammatory effect in the patients. So it just reproduces that waveform over and over again versus the other types of shock wave. But it creates an acoustic wave, and it goes into the tissue, and it decreases inflammation. It actually recruits the stem cells, which is our body's cells to induce healing. So, and it can also increase strength and range of motion at the same time.
So what symptoms would I have that I could go to you to be treated for that? And is it invasive? How long does it take? Tell me, let's say I've got some pain. So tell me what would get me there to you.
So mainly it's musculoskeletal pain that we treat. Some of the common conditions that we treat are medial and lateral epicondylitis, so golfers and tennis elbow.
Okay.
Another one is plantar fasciitis.
Right.
But any musculoskeletal pain that you have is a potential option for this treatment. So anything, I'm happy to field any calls. Our number is 334-213-3606 at the office, and happy to see anybody to talk more about it.
Well, talking about now, does it do anything for like sciatica, anything like that? Anything like?
It can treat low back pain as well.
Okay.
It can treat. It's not going to cure arthritis, but it can make it more functional for patients.
Oh, because that is inflammation.
Mm-hmm.
I know.
So it can potentially create more fluid in the joint and decrease the pain with arthritis. How fast does it work? Some people get 5 to 20% improvement after the first treatment. Sometimes it takes 1 or 2 weeks to see the treatment.
Okay.
But we are doing a special right now that's $49 for the first consultation.
Wow.
So it's a very good opportunity to potentially reduce pain symptoms in patients that doesn't require medications. And a lot of patients are on chronic pain medicine.
I know.
And so this is an option that could potentially get them off of some of that.
So if I did that, how long would I expect it to take? If I come to you and I have something this will be great for?
On average, probably 5 to 6 treatments.
Okay.
For some of the more chronic conditions, it may take more.
Okay.
But we're doing package deals
Okay.
and be happy to talk more about it at the appointment.
But it doesn't take that much time in your office, and it's non-invasive.
Correct. Yeah. I mean,
love
the first appointment would be 30 minutes, and
Okay.
then the subsequent appointments are 15.
Okay.
And sometimes we can get them out sooner than that.
Okay. Anything that will relieve pain, do that job without being constantly on medication that has all those side effects. I am so pleased. As I understand it now, your practice is the only practice in Montgomery that has this.
Yes, ma'am.
Okay.
And we're definitely excited to bring it to the community.
We thank you very much, very much. And folks out there, realize you don't always have to be on drugs. There are other and better ways. And Dr. Thomas Lindsey, we can't thank you enough, and we will have you back.
Thank you so much.
And thanks for being with us.